Just to make you all aware, today's meeting will be recorded. Can I also welcome any members of the public and press to today's meeting? Can I kindly ask you to observe the meeting only and not speak or participate? I would also, hang on a minute. This is saying I'd also like to welcome members of the Education, Skills and Scrutiny. I haven't read this.
Chair, if you just leave that bit out, that's fine.
Yeah, it also refers to the 3rd of March 2021, but I spotted that one. Right, okay, carry on. Can I please remind you all to switch your phones to silent for the duration of the meeting? In addition, can I refer you to the protocols for remote meetings which have been previously circulated, namely, your microphone should be switched to mute unless you are speaking. Should you wish to ask a question or make a comment, can you please indicate either via the chat function or by raising your electronic hand via Team? I will assume that you have all read the paperwork before us today prior to the meeting. Please only use the chat function to indicate if you wish to speak as an alternative to the electronic hand function or to raise any technical issues. When asking a question, can you please indicate which page number you are referring to? The first item on the agenda is to do a roll call. I am Councillor Lynette Purcell, I am the Chair and I am present. I will now call on Chloe, the Democratic Services Officer, to take the roll call.
Thank you, Chair. I've marked you as present. Councillor Charlotte Goldsworthy.
Present, Chloe. Thank you.
Councillor Arthur Davis.
Present.
Councillor Oliver Davis.
I think he's given apologies.
Okay, thank you. We've also had apologies from Councillor John Miller and also had apologies from Councillor Suzanne Paddison. Councillor Sonia Reynolds. The Dave Whitelock.
Present, thank you, Chloe.
Councillor Aaron Wilcock.
Yes, present, Chloe, thanks.
Councillor Carolyn Edwards.
Present, Chloe.
Councillor Wyndham Griffiths.
I'm here, Chloe, thank you.
Councillor Helen Kerry Clark.
Present.
And Councillor Nicola Davis.
Present, Charlotte.
Then Cabinet members, Councillor Alan Lockyer.
Present, Chloe.
And Councillor Peter Richards.
Present, Chloe.
Then officers, Andrew Jarrett.
Yeah, I'm here, Chloe.
Angela Thomas.
Present, Chloe.
Kerry Warren.
Present.
Robert Davis.
Present, Chloe.
Sarah Waite.
Present, Chloe.
Chris Frey Davis.
Present, Chloe.
Mike Potts.
Present.
Hardin.
Present, Chloe.
John Hodges.
Present, Chloe.
And Tammy Davis.
Present.
I missed any officers who are participating in today's meeting. Oh, I can see Shelley Howard's got her hand up. I'll mark you as present, Shelley.
Thank you.
That's the roll call complete, Chair.
Thank you very much. The next item is Chair's announcements. We have one item on our
Chair, before we go on.
Sorry, who's that? Was somebody speaking then?
Yes, it's Councillor John Miller, Chair.
Oh,
just
hello,
to say that.
Oh, thanks, Councillor Miller. I'll mark you as present.
Right, okay, John's back. Okay, Chair's announcements. We have one item on our scrutiny agenda today, which we will be scrutinising, which is the verbal report from Angela. And we have decided to scrutinise items 7, 8, 9 and 10 of the Social Care, Health and Wellbeing Cabinet Board agenda. Are there any other items contained within the agendas that members wish to scrutinise for anyone who wasn't able to attend the pre-briefing? No, fine. Thank you very much. The next item is declarations of interest. Can members please indicate whether you have any declarations in relation to the items that we have chosen to scrutinise? Chloe will then circulate a declaration of interest form via email for you to complete. Have we any indications? No, thank you very much. So we now turn to the minutes of previous meetings. On September 21st, first of all, I would like to thank the officer for the extremely detailed summary, because it was a very long and complex meeting. Before I asked for confirmation of the accuracy, there were several statements made by Titarian of intended actions during that meeting, which I have emailed to Chloe, who has emailed to the officers, and the replies to those will be circulated to us, as we don't have a matters arising section in this committee. So, apart from that, is there anybody who has any observations to make about the minutes? And if not, can I ask for confirmation, a proposer and a seconder, please? Any
I
observations?
propose.
Thank
I
you.
propose.
Copy the second, Chair.
Thank you. So the next committee meeting was January the 20th on 2022, and I apologise for having been absent for that. Before I ask for confirmation, again, one other observation to make. We work hard in this committee, as we all know, and I think we can very much welcome the fact that the Health Board have paused the consultation as a result of us asking to be involved, to be quite honest, in the consultation. So, can I ask for confirmation of these minutes if nobody else has anything else to raise? We happy? Can I have a proposer, please?
I propose, Chair.
Thank you.
I second, Chair.
Thank you. So I'll give you 2 minutes now to get yourselves onto the cabinet papers, hoping that my ModGov is actually going to behave.
Chairs, they're still on the
No,
scrutiny
no,
papers.
no, I have done something wrong. We should be still on scrutiny because we should be having the impact of COVID-19, and it should be Angela. Right, give me 2 seconds whilst I go back again. Okay, we can do this. Yeah. Definitely demob happy. Right, where am I? Okay, impact of COVID-19 on the sustainability of older people care homes in Neath, Talbot. Verbal update from Angela Thomas, who will provide us with an update on this item. Off to Angela.
Thank you, Chair. As it's been explained to me, and forgive me if I've got this wrong, but I've been told that you want a reason why I haven't provided a written report to scrutiny today. Is that correct?
Anything you want to tell us?
Right. Okay. All right. So just to inform committee then, you know, we've always been open and transparent with committee in terms of how we're dealing with the care home sector. But frankly, at this point in time, the timing isn't quite right. Care homes are still functioning between recovery and response mode. So the situation can change day by day, hour by hour. So that's the position we find ourselves in. And it would be unfair of me to try and paint a picture of the care home sector today by deferring this to sometime later, probably June, July time. I'd have a bigger insight into how this sector could look in the future. Suffice to say, care homes are managing. You know, I won't go into any great detail today. They are managing. We have had to step in, as you're aware, as a council and supported them in volunteering where there were staff shortages. But aside from that, we are managing as we have already done throughout the pandemic. We think we're coming out the other side, but it is too early to say that at this point in time. So in terms of sustainability of the marketplace, I'm not in a position to say exactly how that might look, but we'll be in a better position, I would say, in about 3 months' time. And that's where we're at, Chair.
Thank you very much. I'm sure the scrutiny committee would be happy to accept that. But is there anybody who's got any specific questions? Can't see any indications. So we're happy for that. Charlotte, can I just say one thing before you begin, Councillor Goldsworthy, just to remember that we are in public and to be careful not to identify any particular home by name. Thank you. Take it away, Vice Chair.
Hi, Angela. No, it's just a question as in, what is the current situation with the care homes by way of staff? Is there still big issues with recruitment with staff at the moment?
Yes, it's fair to say there is still an issue, and some homes are relying very heavily on agency staff. We are obviously working as a council to look at the whole of the care sector workforce That is a piece of work being headed up by Karen Jones, our Chief Executive. Similarly with the domiciliary care market, it is still stretched, but we're doing all we can to support these homes throughout. So, yeah.
And if I can just come back as well,
Yeah.
in regards to vacancies as well of obviously beds, how are we looking there, especially around respite? Because obviously I'm aware that there are many families now where obviously sort of you know, a breaking point. So where are we obviously with the numbers with respite placements?
Well, we are trying to provide some form of respite. As you know, we've been struggling with some of the homes because of COVID. We've not been able to provide respite to any great degree. What we've been trying to do is provide alternative forms of respite to give carers a break. So we've had a number of schemes where, and it's quite interesting, a lot of carers who've taken up this form of respite, they're not asking for, you know, a week away or a week abroad. They're asking for a couple of hours to have their hair done or their nails done. And Sarah Waite and Shelley have both been, excuse me, leading on some of this, and we are progressing that into next year. So we're taking a whole new look at respite. Yes, people want breaks, and what we've been doing where people have really been struggling or into breakdown with families is putting people into extended care. It's another form of, you know, it isn't respite, but it is taking somebody away into a residential care home for a couple of days to give the family a break. But we are seeing other forms of respite coming out, that people are just happy to have a couple of hours off, a couple of hours to go shopping, meet a friend, go for a coffee. So we are looking at a whole range of things that might look different coming out the other side of this pandemic. So yeah, it's, you know, respite isn't entirely back where we want it to be. We are now via panel getting a lot more requests, and we are actually approving respite because we're back in position of being able to do that, which is something we hadn't been able to do for the last 2 years. So it is happening. Wouldn't pretend to say it isn't challenging, but I think we're looking at far more alternatives to the traditional just going into a residential care bed for a couple of days and coming home. That's not what families are telling us they want.
No. Chair, if I can just have one more question, please.
Yeah, carry on.
Yeah, in regards to, and I totally agree, you know, lots of the carers, as you say, just want that few hours out and things like this. What I've stumbled up against is more around the assessment stage of, obviously sometimes if obviously they might have dementia and they're living with family and that, but then sometimes they need that extra assessment, but it's the waiting times of the assessment which is sometimes a hold up, and I've got one now. So, you know, is there anything? So again, this is only a couple of hours and that. So what, you know, are there big problems there in the hold up for the assessments?
There shouldn't be. We are pressed, and I wouldn't pretend to say otherwise, we're pressed from the community demand and the hospital demand. So we are getting pressed from all sides at the moment in adult social care. But if there are individual cases, Councillor Galsworthy, that you are struggling with, you know, you pick up the phone and let me know what that's about, and we will progress that as best we can. I have had
Yeah, that's all been done now, thanks. Brilliant it was. But yeah, thank you, Ange, and I totally take my hat off to you, because it's like a never-ending whirlwind at the moment since this all started. So, you know, you and the team have been absolutely amazing. So well done.
Thank you. Thank you very much.
Thank you for those questions, Councillor Galsworthy. Councillor Whitelock.
Yeah, thank you, Chair. Angela, just on the back of what you said then about looking at short-term couple of hours respite, is anybody looking at the resurrection of the old day centres then? Because that was a day respite at one time, which we used to have right across the borough.
You're drawing me into some discussions that are really on my... Well, to be honest, and I make sure I don't say the wrong words here. Yes, in fact we are, but we're not going to say we're looking at day services. It was something that decision was taken way before my time. You know, when that decision was taken. I'll be honest, you know, hindsight's wonderful, isn't it? I think by shutting day services, what we had was the impact on domiciliary care, and what we're seeing now with carers, etc., etc. So we are looking at all forms of alternatives. So, for example, we have some extra care schemes with huge kitchens and huge common places where people could congregate. we're looking at, you know, we brought a report to the last committee on our looking at our bespoke services, independent living, community hub type things. The work that Sarah Waite is leading on in terms of community development, early intervention, prevention. So absolutely, Councillor Whitlock, I'm not going to call it day service, but we're absolutely looking at some form of respite provision, which is different to what we have now.
I thank you for that.
That is very refreshing to hear. Excellent news. Right, okay, I can't see anybody else indicating. I think I've caught up with my computer and my computer's caught up with me. So now we are ready, because this report was just for information. It's just a verbal feedback from Angela. I can see questions that we will be wanting to ask as a committee in the future, and no doubt she'll be coming back to us with more detail in the summer. Thank you. Now we are going to move to the Cabinet Board agenda for pre-decision scrutiny. And we are going to be looking at items 7, 8, 9 and 10. So now I'll give you a couple of seconds to change over to your Cabinet papers. Thank you. Sorry about this, ladies and gentlemen. It's being difficult again. Just try once more. See if I can get this up. Yes, okay, we're looking at agenda item 7, which is the quarterly performance indicators. Dave Harding and Mike Potts are here to answer questions about this. Have you anything to add, or would you like to go straight to questions?
Yes, straight to questions, Chair.
Thank you. Right, I've got several questions, but is there anybody who wasn't able to make it for pre-briefing who has anything that they'd like to raise first? Okay, can't see anything. Right, okay, here we go. On page 15, right, PI 530 and PI 533, it's noting an increase in pressure in the single point of contact care centre. And 533 notes that there's been an increase in the number of cases in which risk is being identified as a result of the Section 47 inquiries. Could officers just let us know that, as I suspect, that this is COVID, isolation, lockdown related, that we're getting these increases in pressure?
Hi everybody, if I come in at this point.
You, Kerry.
Right. So yes, the front door, the single point of contact, have been under huge pressure throughout the pandemic. We were ready, we were prepared, and we were ready, and we've been very responsive in terms of the resource that's gone into the front door, which has greatly increased over the last 2 years. So we've been able to put in additional social work staff to respond to the demand, and additional support staff. And just to reassure you that Children's Services has maintained a safeguarding responsibility, obviously, throughout the whole pandemic. So we've continued to visit families and children who are vulnerable in the community, in schools, wherever we've needed to attend. So that didn't change throughout the pandemic. I'll bring Dave in if he wants to add anything, but you are absolutely right. We saw a huge rise in demand, and that's how we've met it really over the last 2 years. I'd like to say that we've seen a decline. We are starting to see things slow down, but demand remains high within Neath Talbot. Dave, did you want to come in with anything further?
No, I think you've covered it there, Kerry. Yes, the demand, we have seen a fluctuation in demand, really. It seems to be peaks and troughs as well, whereas some months we will get a significant increase in referrals, other months then it does drop off slightly. But in terms of resourcing that, I think Kerry is right. There's enough resource being put into the front doors. We are meeting demand as it come in. And where we have been under pressure, we've had other areas, the service help out as well. So it has been quite a responsive approach from across the service, not just in the front door.
Thank you for that. I can see Councillor Miller is indicating.
Yes, thank you, Chair. Can I apologise for not being at pre-meeting? I hope the explanation was okay. I got to say everything is fine on this. So that's good.
That's really
I'm on page 14, Chair, and it's the indicator 241. If someone can explain, please.
page 14. Hang on whilst we find it. What was the specific question, Councillor Miller?
It's indicator 241. There's not really much to go on there. If someone could explain, please, why it's a red sign.
I've got you. Yes. The re-registrations of children on the local authority child protection register. Yeah, that's it. I'm sure Kerry would be able to answer that one for us.
And what I'd say in respect of that is that we've actually created sort of an arrangement with our partners, so with our local schools, with health visitors, and with families, where they are encouraged to re-refer should a situation change in the future. So we need to be careful about that number. It mustn't simply be seen as perhaps a concern. So we regularly monitor the re-referral rate and we audit all of those cases to see whether there are any lessons to be learned. But it's also inherent in the system that we would say to a family or to a school, we've carried out a piece of work, we've, from an assessed position, that may have worked very well over time, but should a situation change in the future, should partners become worried or a family be in need of support, be in need of some additional support again, then we would encourage them to re-refer. So we must bear that in mind with the re-referral rate. But in terms of the figures, they're closely monitored and audited. So if we can see that any themes, if we can see that there's any lessons that need to be learned, then that sort of information then goes back into the service in terms of a lesson learning exercise around that rate. But that isn't a figure that I'm concerned about.
You happy with that? Yeah. Okay, thank you. Councillor Goldsworthy, I can see you indicating. Vice Chair.
Sorry about that. I don't see it so while because my screen is cracked. I just want to go to page 41. I don't know if I'm jumping a bit too far ahead at the moment, but it's going to the childcare disability numbers.
Page 41. Right, hang on whilst we find page 41. Hang on for 2 seconds. 41. Got it. So in the higher level measures, do you mind awfully, Councillor Goldsworthy, if we just deal with the performance indicators for a second and then get onto the high level measures? Because
no problem at all. Just call me when you're ready.
I'm just putting you on pause, right? Okay, thank you. Because I'm on page 18, so we're still in the PIs, and I've also discovered that as well as my computer not allowing me into private, it's also managed to erase all the highlighting that I'd done. Never mind, I found it now. It's delayed transfers of care. It's PAM 025. It says there that we're unable to calculate this performance indicator as no data has been provided by Welsh Government since March 2020. Obviously, this is something that's very sensitive, delayed transfers of care. So I just wondered if the officers could elaborate on that.
I don't know if Mike wants to come in. I believe this indicator was stepped down at the start of the pandemic, Councillor Purcell. What I can reassure committee is that I am aware of everybody sitting in a hospital bed, everybody on a brokerage list waiting for a package of care or a residential care placement. I have that breakdown weekly. So you know, there is nothing to worry about. Yes, we have delays, but I'm well aware of where they're at and the reasons why. More to the point.
I think that is the reassurance that we wanted as committee. Thank you very much. All right, page 19, and again, oh God, AD 020 to 024. Let me see if I can find that. Oh yeah, I can find it. To a layman or to a laywoman or to committee, it would appear that there are more cases of adults at risk being reported. Then there's a comment about this, about people being more cautious. But the number of reports that led to inquiries needed is 20%. So I just again wondered if officers could elaborate on that. Is it that, I mean, I'm just interpreting, trying to interpret this myself. Is it that people are being more cautious and therefore they're almost over-reporting the possibility of somebody being at risk, which then investigated is found not to be the case? But basically, can you just elaborate on it?
Yeah, happy to take that question. A combination of reasons, Chair. One, we do encourage reports. So even where our partners are have just an inkling, you know, we do encourage them to share those concerns, because what they don't know is what we hold in terms of concerns already shared to build a bigger picture. We've got a number of places then when an adult at risk comes to us, that doesn't automatically trigger a safeguarding response. We do have really experienced front doors across children and adults, which slow the process down, go about gathering information, undertaking lateral checks, and that might result in someone receiving advice, support or care and support as a result of that report, so not necessarily safeguarding. And then we've also changed how we approach adult safeguarding. Before we moved safeguarding to our front door, what we did have was a lot of our safeguarding cases going into, everything went through to adult safeguarding. Now we delineate out to those that relate to professional concerns, those that relate to adult at risk, and that in itself has seen a significant reduction in those Section 126 inquiries. So, for example, if there were an allegation made against a care home worker, we wouldn't always go Section 126, because that worker would have been removed, suspended, so the risk would have been removed. We would support that individual, of course, but there's another process to deal with professional concerns. So we've seen a lot of work gone on at our front door in our safeguarding team and with our professional concerns, and all of those are factors in a lower number. What I would say, though, it is a number that we are carefully monitoring and checking it. We check in monthly as a safeguarding team to look at some of those cases as well.
Thank you very much for that. It's just this detail that I think we need as a committee so we can interpret what's going on. That's brilliant. Thank you. We're on to the higher level measures now. So we're coming to your question in a moment, Councillor Gosworthy. There was just one on page 32, which is I was slightly concerned on a personal level to see the high number of cases being held by the disability team. If we have a look at it, it's the highest number of cases. Is there any particular reason why the disability team should be carrying those sort of high numbers? And are officers satisfied that the situation is safe? Anybody?
If I come in there, Chair, with regards to children with disability, key.
Oh no, everybody's frozen.
So again, there's a close monitoring of the caseloads across the whole service, and we have brought additional staffing into the children with disability team, and we also have a number of specialist workers in that team. So rest assured that there isn't any unallocated cases, and all of those cases are appropriate for the team. and managed safely within that service, so that we regularly monitor that situation, so that there isn't room, there isn't a great deal of scope to move cases once they've met that criteria for children with disability, given the nature of the reasons why those children are being supported by support staff and social workers in that team. But what that does mean is that it's built up a huge level of experience and expertise within that service. So it isn't, it's a busy team. There's a lot of work going on in that team, but there certainly isn't a concern with regards to the volume of work. It's certainly manageable and it's certainly safe.
Right, I think we can trust you to be on top of that. Brilliant. Right, Councillor Goldsworthy, you wanted to ask a question on these higher level measures.
Yeah, it's it obviously, again, as Lynette just said, for the high numbers, the disability with children. What I'm actually wanting information on is about the what provisions and support do we have in place in the borough for those young people with profound multiple learning difficulties, obviously after they leave school, to obviously then, you know, with the ALNET bill and that now, about when they leave school from 19 to 25, what is it that we've got? Because I've been led to believe that the only suitable provision is in Cheltenham. And basically then that would mean obviously bed on spaces as well as money as well, financial. So I'm just inquiring about, you know, what do we actually provide for those individuals and how many of them are in the borough.
Okay, Councillor Goldsworthy, that isn't a measure that's being reported on in the report, unless anybody else can find it. Do you mind awfully emailing that question to officers, because we can only scrutinise what is in front of us. Unless I've got this wrong, can any other committee member find any clarification of exactly what page number Councillor Goldsworthy is referring to?
I was looking at the statistics on 41, but obviously
41, right, hang on.
The high numbers there is basically it's the number of care and support plans. Well, obviously, as a support plan, I'd actually like to know what provisions and support that we're actually giving to those individuals with the childcare disability team, with the profound multiple learning difficulties.
Right, okay, I've got you now. Is there any officer able to answer that now, or would you prefer the question to be emailed to you?
I would suggest, Chair, in order to do it justice, you know, the officer, I don't believe Vic Smith is on the call today, who's the principal officer for children with disability. In order to do it justice, if we could have a permission to put a short report for you together and yeah, outside of this meeting.
Yeah, I think that you basically asked a very interesting question, Councillor Goldsworthy, and we do want a detailed answer to this. So if we can if you email that question to me and to the officers and to Chloe, then they could bring back a report to us, to the committee in the new administration after May. Thank you very much for that. So we're now on to page 42. High level measure 12. It's just amazing. There's so much to welcome here. It's difficult to pick out any one event or initiative. There are so many positive activities, learning to cook, learning to manage finances, etc., etc. One that I particularly liked was the fact that the emergency services are being taught essential phrases in British Sign Language. I thought that was a really interesting idea. You know, it's an extremely good idea. So basically, I just wanted to say that is all wonderful, right? Page 42, higher level measure 12, absolutely fantastic, particularly rewarding when you think of the journey that we've been on to get to that stage. So congratulations to everybody. On Appendix 6 on page 48, there's a learning review. If I can just catch up myself here. Now, I realise that we are in public, so we've got to be very careful. But I've read it, and I just wanted to know, how was the case chosen? I'm approving of the methodology to learn lessons to see if the working background, both physical and psychological, affected decisions made by the social workers. But can you assure the committee that the point of the review is, as you state in your report, not to assign blame or responsibility? And was this in fact the way that this was carried out? Anybody, any comments on that, please?
I'm gonna come in very quickly, Chair, to bring in Chris Frey, because I know he's chomping at the bit to answer. But just to reassure you, I think it's been acknowledged in our recent sort of multi-agency inspection, you know, the JICPA that we presented to you a few weeks back, and that is about establishing a learning culture within Neath Talbot. So we take those opportunities to lesson learn, but it is a genuine attempt to get people together. We do that with our own officers within Neath and also with our partners. And the feedback we get from that is quite humbling, because, you know, staff appreciate the time spent and appreciate the approach we take with regards to learning lessons. So I can assure you it's seen as a very positive experience and couldn't be any further away from you know, sort of portioning blame. But I'm going to bring Chris in now, because that's his baby.
Thank you. Take it away, Chris.
And not much to add, Chair, but to say, you know, it is very much a reflective space for practitioners. It is very well received now. It's very well established. So we've undertaken a number of learning reviews. I'm more than happy to share the criteria that we use to select those cases through the Quality Strategic Practice Group. And it is a criteria that we're always looking at as well, because we do recognise the importance of that feedback loop in the system in terms of learning. But what I would say in respect of this case is it was the result of any case that progresses to a child or adult practice review. We hold an internal learning immediately in a bid really to identify early learning. So we don't hang around. We're not waiting for a child practice review to tell us where we may or may not have gone wrong. We look to do that ourselves so we can make sure that informs practice immediately and without any delay.
Thank you for that reassurance. But I think we did need to ask the question. Thank you very much. I have no more questions myself. Is there anybody else on the committee who wants to raise anything that we haven't covered? Everybody happy? There's no recommendation for this item. It's just for noting. Okay, so we're now progressing to agenda item 8. Right. The deprivation of liberties, which is going to become liberty protection safeguards. Andrew is the lead officer on this. Has he got anything to add before we go straight to questions?
No, thanks, Chair. I mean, the report is in my name, but Chris Frey will answer any difficult questions that you might have or any technical questions.
Okay, thank you very much for that. I know Councillor Woolcock's got an interesting observation to make on this, but before we go to that, I just wanted to welcome on page 63, it's talking about expecting improved outcomes, and that's all we obviously all want. And I also wanted to thank whoever wrote the report, and I don't know which officer it was, for the extremely clear explanation in the legal context section, because this is so difficult, and yet I actually understood that, which is good, right? So it must have been very well spelt out. Thank you very much. Arwen, did you want to come with your question or your observation, Councillor Woolcock, first?
Yeah, thank you very much, Chair. I appreciate your indulgence. Yeah, all I wanted to say, Chair, is that I understand that officers are undergoing training on the new setup that will replace dolls, and I'm just wondering, Chair, whether it would be beneficial for members to have a seminar on this particular subject. The new council, of course, is pointless going into a seminar now. I, like you, will be retiring, so it won't apply to me. But I think it is very, very beneficial indeed for newly elected members and sitting members as well that will be re-elected, because this is a totally new setup, and I think a seminar would be very, very appropriate and a good thing to do for the new council after the 5th of May. That's all I wanted to say, Chair. Thanks very much.
That's an absolutely excellent suggestion. I can see Councillor Miller indicating.
Yeah, thank you, Chair. I notice on page 61, there's a reference there about the review, and it states whether it's in-house versus agency. Now, my own opinion is unless there's a legal reason we can't have it in-house, that would be preferable, because that's the only way that the council have full control over the issues. Thank you, Chair.
Would any officer like to comment on that?
Preference would, of course, be in-house. Agency is in there to reflect our current response. We only use agency where we need to respond in that timely manner to those more urgent requests for dolls at the moment. And as the report alludes to, you know, we've always, in this world, we've always worked to a backlog. That's just through the sheer demand that dolls has brought, which I hope is set out in the report in terms of where we were and where we went to as a result of that key case law, Cheshire West.
Thank you. Are you happy with that, John? Yeah, thank you. Councillor Arthur Davis.
I'm sorry to bother you, Chair. I've just had an email which is urgent and I've got to leave. I'm terribly sorry.
That's okay, no problem. Thank you very much. And best wishes, Arthur. We may not bump into each other again, virtually or otherwise. Thank you. Thanks very much. I did have one question, which was on page 58. We know that there's no start date for this because of the implications of COVID. And I wondered how the officers were managing with budget planning if there is no start date. Because on page 58, it says the existing team may need to be expanded. Are officers confident that they'll be able to recruit the necessary new staff? And how are you managing for juggling the sums?
I think, Chair, as you've probably noticed, and you make a good point, the report is littered with mays, and that is simply because we are waiting for codes of practice. We are waiting for other Welsh Government working groups to feed into our regional working group. So at the moment, it feels like a lot of guesswork. So we are working. Some of the figures, as you've seen, are conservative. That's as best we can do across the region. But we're hopeful as we are sitting also on those Welsh Government groups that with a bit more time now, we don't know when it's going to be introduced. We suspect it might have been put off for another year, and that might give us ample opportunity to hit the ground running. I think, you know, having drafted the report with Zoe Jones, I think it's fair to share Zoe's name in terms of that point you raised earlier about the clarity of the report. We welcome it being put back in some regards because it does give us more time to plan as a local authority and indeed as a region, because we are working closely with Swansea and Health on this as well.
Thank you for that. I can see Councillor John Miller indicating.
Yes, thank you, Chair. Page 65, right at the top, information technology. I would hope that we do not adopt a standalone system for Neath or Talbot. I'm going back a few years now where the police in South Wales had a standalone system which didn't talk to any other police service in the country. And similarly with the health service, they had a standalone unit in ABM which didn't talk to anyone else. Can I just urge caution on that side of technology? Thank you, Chair.
That's a very interesting observation. Thank you very much, Councillor Miller. I'm sure officers have taken that on board. Right, I see no other indications, and there was no recommendation on this item. It was just for noting. So we're happy now to move to agenda item 9. Just give you a couple of seconds to find that. Right. Now, this generated a lot of discussion during the pre-briefing, because I think it's something that we're all very interested in. So we'll start off with Angela, is there anything you would like to add?
No, Chair, it's self-explanatory. It's a pilot that we want to enter into. We've got some money to be able to do this. It's based on fact and research of what we see as falls and affecting the ambulance service. So I'll go straight to questions, Chair. It's pretty self-explanatory.
Thank you very much. So let's start off with the positives that we came up with. We welcome the idea. We welcome the whole concept of the pilot for the 6-month 24/7 support and finding out whether it works. We also appreciated the fact that the financial implications of not doing this are well described on page 77. And we also welcomed the fact that on page 76, there's an observation that if it proves successful, that there will be a possibility of investigating bringing in the service in-house. However, for the pilot, I personally was impressed by the recommendation to use Delta, page 81, which has a demonstrably successful track record and particularly can provide bilingual support. So those are all our positives. Wyndham, Councillor Griffiths, did you have a question?
Yes, thank you, Chair. As the Chair indicates, this is a positive report, and I welcome it. I think it's a real plus. The only concern I have is that it only covers people who are on the lifeline. Is there any way, or can we look at bringing other people who are being cared by the carers, their family, that they can be brought into it somehow? I think further down the line there might be something so that, you know, it'll encompass every person then who could have a fall. Thank you, Chair.
Angela, do you want to come back on that?
Yes, of course, and absolutely. But that is the whole point of this pilot. It is very small. It's a small amount of money just to trial this in one very small area. So we've located the Avon area because we currently got a setup with health in the Swansea Valley and the Neath areas. So that was the reason we chose this part. There are a number of avenues we're exploring. So this is just one tiny part, proof of concept. Could it work? I'm also exploring whether this is something that our in-house home care service could utilise. We used to run a 24/7 service many years ago. Back at the time we analysed that, the need wasn't there through the night. Times have changed, as you can see from the statistics. So absolutely, and this is only starting with people on a lifeline. This was just one small pilot for a couple of months, but the issue eventually would be to spread this out across the whole for anybody requiring care, for all the reasons it states there. I will obviously be bringing the evaluation of the pilot back to committee to see if it was successful.
Thank you very much for that. I suspect that Councillor Edwards and Councillor Kerry-Clark, who indicated during pre-briefing, those observations that you wanted to make may have been answered. But do you want to come in before I go to Councillor Miller? Carolyn, did you want to raise anything?
Yeah. Just very quickly, Chair. Thank you for the report. It's an excellent project and an excellent way forward. And I would support Councillor Griffiths in what he's saying. There's an awful lot of people living out there alone or with family carers who just do not know who to call if they have a fall. So, you know, this is a really good forward-looking project to be carrying out. Thank you.
Thank you. Councillor Kerry-Clark.
Thanks, Lynette. Yeah, just following on what Carolyn and Wyndham have said, really. I mean, as you know, I work with people who frequently have falls, and a lot of them can't afford to participate in the Lifeline service without accessing grants and things like that. So would it be possible to maybe work with the welfare benefits section and the third sector to increase the number of people using a Lifeline service through the access of grants?
Absolutely, and I'll bring Sarah Waite in to respond to that query.
Thank you.
Yes, definitely. I think there's a real big opportunity at this stage with the partnership working that we're doing with welfare, the preventative agenda in itself, to be able to look at where there are opportunities and how we can maximise them in with this programme. Running alongside this is actually a smaller project called Armed, where you don't need a lifeline, and as part of that project, it's very much based on preventative work and a monitoring system, so we can support people before they fall, hopefully. So yeah, more than happy to link in with the third sector and look at that as part of this project. Councillor Clark.
Thank you. This is very positive. I've got Councillor Miller and Councillor Whitelock indicating. Sarah's just mentioned Armed, Councillor Whitelock. Was that your question, or did you want to ask another question as well?
No, it was on the Armed.
Well, then with that one, then we'll go to John.
Trying to work out what Armed stands for, because you've got Avon Valley Cluster, and to a lot of people in the valley, armed means a vehicle shooting up with its blue lights on, and armed police is there. Just want to know what Armed actually stands for, please.
And I can't tell you that off the top of my head, unfortunately. Sorry. It was an initiative that we've worked with partners up in Cardiff who ran it at the beginning of the pandemic and saw a significant decrease in the number of people who were falling because of the prevention element. So it's a wearable device that you, like a sports watch that you wear, and it monitors your activity level and your blood pressure, and that's reported back to base. And we can then see if there's a change or a fluctuation in the way that how your mobility is. And we've got links then to obviously Delta to come out and do welfare checks, but also to link with our physio in-house who can then recommend any exercises. I will say it is very sensitive. So if you are feeling a little bit tired in the morning and you've had a late night the night before, then it will adjust to that. And it will pick it up. So it's based on a baseline and a fluctuation over a week then. So it's exciting times for that project.
That is a very, very interesting thing to talk about. Councillor Miller, I can see you indicating, but the director wants to come in and it might be directly relating to what Sarah's just said. So can I put you on hold for a second? Director.
Yeah, thanks, Chair. And just so that Sarah doesn't have to do any work emailing after the meeting, I just quickly looked at what ARM stands for, and it's Advanced Risk Modelling for Early Detection. And it says, is an innovative prevention and self-management certified medical device. ARMED combines pioneering predictive and analytics modelling with wearing technology and health and social data. So that's what it stands for. Not something that's easily trips off the tongue in any case, but just so the Councillor Whitelock is aware.
It's better than my interpretation, which was an electrical device worn on your arm, which of course is armed. But however, that may just be the layman's interpretation. Right, you've been so patient, Councillor Miller. Take it away.
Thank you, Chair. Just a comment and a question, if I may. The comment is, I think this is a wonderful idea. It's the natural progression from the lifeline, and I'm sure if we hadn't had years of austerity and the pandemic, it might have come to fruition years ago. My question is about when are we likely to see this take place? I'm interested to know if we are going to encompass the winter months, which possibly might highlight more falls themselves. Thank you, Chair.
Anybody?
I'm happy to pick that up as well, Chair. So we are looking, Councillor Miller, to start this as soon as possible. So if we get the go-ahead from yourselves, we would be looking to have this up and running in March. Well, it is March already, but towards the end of March, beginning of April. So there's been a lot of pre-work done beforehand to look at how we could, the groundwork has been done then to get this up and running. So it would be covering March, and won't quite hit into next winter's months, but it will give us an opportunity, I think, to evaluate, and if it is good, sort of put a case forward ready for the coming winter of this year then.
You happy with that, John?
Yeah, my concern, Chair, was that obviously during the winter months or the cold period, then people are likely to leave their heating off, etc., and that may increase their probability of falling, etc. I was hoping to capture that to ensure that you know, we had a good outlook on that. But thank you anyway.
Okay, thank you for that. I can't see anybody else indicating. Before we go to the recommendation, which is on page 80, I just need your support on the observation on page 82, which says the implementation of the decision, that the decision is an urgent one for immediate implementation, subject to the consent of the relevant scrutiny chair, because of this tight deadline, because of the grants. So before we recommend for this to go to Cabinet, is the committee happy for this decision to be made urgently with the support of the scrutiny chair? Can you nod or give me a thumbs up or something? Yeah, that's great.
Yes, no problem.
Excellent. And can we therefore go to the recommendation on page 80? Are we happy to send this through to Cabinet? Yes.
Yeah.
This, yeah, everybody?
Yeah.
Okay.
Yes.
Not exactly a formal proposer and seconder, but it'll
Yeah.
do. I see lots of nodding and hands up. Brilliant. Excellent. Okay. So where are we up to now? Agenda item 10. Let's find that. I have a wonderful relationship with technology, and I think it's just doing this personally because it's got something in for me, because it's the last one that I'm chairing. So all my highlights have disappeared, but never mind, I found agenda item 10. Angela, do you want to add anything to this?
No, Chair, we'll go straight to questions.
Thank you. I was particularly pleased, because I've been going on about this for years, to see that there was a proposed easy read version, and also this plan on a page. Is the plan on a page a new idea? And basically, is it what the title implies, that you simply got one sheet of A4 with a description of what it's all about?
I'll ask Lynn to respond to that, Councillor Fassar.
Yeah.
No, we tend to do the plan on a page for most of the strategy work we do, and it is exactly what
Right.
you set, you know what it is, all the key points on a page, so anyone can look at that very quickly and easily and understand what it is we're intending to do, or what that strategy is telling you.
That really is excellent progress. I'm very, very pleased about that. And also, I wanted to congratulate officers on the layout of the strategy. Subheadings such as where are we going, etc., makes it much easier for a layperson to read rather than pages and pages just of prose. So thank you for that. I have no indications at the moment, and I have got a couple of questions, which of course I won't be able to find, but never mind. On page 106, yes, let me just catch up myself. Somewhere on page 106, it says that the Welsh Government has amended the legislation at the beginning of the pandemic, which we are all aware of, and this has more than doubled the demand for emergency housing. So I just wondered whether the Cabinet members and the directors are aware. Are we assuming that these new regulations are likely to continue? Anybody got any observations on that? Andrew?
Yeah, thanks, Chair. I think Rob Davies is on the call. He would be best placed to answer this. My understanding is that yes, they are. That Welsh Government are committed to having zero homelessness across Wales, and are trying to push us to address the huge rise in demand that we are seeing as a result of that change of approach from Welsh Government. But I think Rob's got his hand up, so he might be able to give you more detail.
Welcome, Rob.
Yeah, thanks so much. Yeah, the demand for interim accommodation has more than doubled. I think we've done previous reports in the past. Pre-pandemic, we had approximately 35 to 40 people in interim accommodation. This week we were 151. So, you know, it's more than doubled. It's very, very serious. And this is the same across Wales. Every local authority is in the same boat. I just come off a meeting actually with the Welsh Government just before this meeting. The priority need which they removed, which has caused the rise in the numbers. They're still saying it's suspended, but that's their intention, is to keep it that way. So they're looking at all the authorities to pull together a rapid rehousing model, which is trying to address that. It's a fairly medium-term programme. They're looking at 5+ years before it's implemented, because there's so much to do for it. But it is something we're working towards. But we also have a number of short-term solutions in place. We've got a number of accommodations that are being built, converted as we speak. We're working very closely with the RSLs to increase the numbers. So we're doing as much as we can. We've also got a prevention team at the front end now to try and stop people coming in, try and work with them to work with their debts and this type of thing as well. So we're trying to hit it from all angles just to try and reduce this number that is coming in. But this is our new norm moving forward, without a doubt, this high level.
Thank you for that. I think that anticipates my second question, which was on page 107. It says, we cannot end homelessness on our own. So are the social landlords continuing to support you? And I think you've already answered that.
Yeah, very much so.
Good, excellent. And Councillor Woolcock.
Thank you, Chair. Yeah, you know, this is a point I've raised before. I mean, in the short term, we do need to take some action, but longer term, Chair, and I hope that the new administration, whoever that may be after May, takes on board the suggestion that I previously made, and that is bringing empty homes in the county borough back into or into council ownership. That Chair, can go a long way towards addressing some of this dreadful problem that not just us in Neath, Talbot, of course, but other authorities right across Wales as well. But I do believe passionately, Chair, that bringing empty homes into council ownership and then opening up a housing revenue account for that purpose would be of significant help towards this problem. Thank you, Chair.
Excellent. I so support that, Arwyn. I have got two houses just near to me, very near to me, 3 4-bedroom properties that have been empty for as long as I can remember. Thank goodness both of them are now having work done on them, and they're going to be brought back into the housing stock. But it's been quite a struggle to get to that stage. So I totally agree with you. I can't see any more indications. I can see on page 99 the recommendation. Are we happy for this to go to Cabinet? Can I have a proposal and a seconder, or a lot of thumbs up, please?
I propose.
Thank you. We all happy? Yeah, excellent. Now, we now go back to scrutiny. Thank you. If I can just go back to scrutiny, come out of that. Just have to have a little word with my iPad. There we go. Yeah, not that one. Oh, for goodness sake. Right, I'm almost there. Yes. We're now looking at the forward work programme, which is just for noting. Yeah, this obviously all will be into the next administration. We're then going into urgent items, and you'll be pleased to know that we haven't got any. So we are now almost at the end of this meeting, as we've decided not to scrutinise the private item. But this now is quite an important message that I wanted to get across. To thank the committee for their incredible hard work, the conscientiousness with which you have scrutinised things over the years that I've been the chair has been absolutely phenomenal. I can always rely on you to have read everything and to read it in detail and to think about what you're doing. If this was pre-pandemic and we were in a room now and I was about to say bye-bye to everybody, no doubt there'd be lots of hugs, but we can't actually do that, right? So the second thing that I wanted to do before we come to the end of the meeting is to express my personal thanks to the officers from the director downwards for their incredible professionalism. Those of you who've been on the committee with me for a long time know that I think we can feel that we are in a very good place. We've still got problems. My goodness, we've got the problems, but we've got very, very competent and professional officers who are there very, very adequately, more than adequately, dealing with the problems. So it is my last meeting. I'm going to say bye-bye, except I've got 3 people indicating. So we'll start off with Councillor Edwards.
Thank you, Chair. Just a very short couple of comments. I'd echo your sentiments regarding the officers. I hope I will be back in May and hope we'll still be on this committee. Fingers crossed with that. I'd just like to say, you know, a big thank you to officers, obviously, but thank you to Aaron Wilcock. Good luck to him, and you know, all the best for the future. And thank you for all the hard work that you've put in over the years. And the same to you, Lynette. You know, I've only been on this committee with you this last 5 years. You've been a fabulous chair, and you read everything very thoroughly to keep us in line. So good luck. So good luck on your retirement, to both of you. Thank you.
Thank you very much. I'll come to the director last, I think. Vice Chair, you're indicating.
Yeah, I just basically want to take the opportunity as well. Obviously, I know that very little politics has basically been played in this. Not that I'd actually know how to play that game anyway, to be honest. But even last week, I was actually saying in another meeting how fantastic Lynette has been as the chair of this this committee. She's very, very thorough. And she's also been a good mentor to myself, as well as taught me a lot of things as well as vice chair. So obviously I just want to wish her the best of luck, and I totally second what you've said about obviously the officers and that. And again, I'd also like to but no doubt I'll see Arwen anyway, and I will give him kisses before he goes anyway. So and again, you know, such a great loss, because the experience, the knowledge and passion that both of you have is fantastic, and it's just a sad thing to see that we're not having and hopefully so not everyone's jumping in to be councillors these days. So but fingers crossed, and we will get you know, more quality councillors like yourself, because it is a great loss. Okay.
Thank you very much for that, and I'm sure Arwen's very grateful too. And finally, and I think the last word should be with the director, to Andrew.
Yeah, thanks, Chair. I mean, on behalf of officers, I just wanted to say a few words with your indulgence. And I wanted to extend our thanks really for you, Chair, in particular, but also to all members of the committee for the way that you have constituted the committee and approached the work that we've done together. I think there's, you know, I've had experience of different types of committee during my career, and you can create a hostile and defensive committee, or you can create what you have created, Chair and members, which is an open committee which has been challenging where it needs to be challenging, supportive where that's been helpful to us, incisive as far as the questions that you ask, which has helped us as a service to move on. And that's everything I think that a committee should be. And so I just wanted to thank you all for your approach. As I say, it's been excellent. It's one of the best committees I think that I have worked for. And I thank you all for your understanding, because during the COVID times, we have all been up against it. And at times you have had to be understanding about what it is we can and can't provide to you. And so I do appreciate that. So I just want to say those words, Chair, and wish everyone who we won't see again in this committee all the best, and to say thank you very much, Chair, for the way that you've dealt with this.
Thank you. I think that's a nice positive way to finish. So I am going to say thank you for your attendance, and I now bring this meeting to a close. Thank you.